When I started over 30 years ago, orthopedics was primarily the treatment of broken bones. We did do torn meniscuses in the knee. It was in the early years of total joint replacements, but it was primarily treating broken bones. That has evolved tremendously, where now there's a great emphasis on reconstructing rotator cuffs, reconstructing ligaments around the knees, foot surgery, hand surgery, spine surgery has come miles since then. It was very crude back in the 1980s. The treatment is less invasive, it's less painful, and probably most importantly, it's less risky. It's a better world right now than it was back then.
I get calls from a lot of my residency friends in orthopedics who are now either spine surgeons or foot and ankle guys calling about knee and shoulder injuries. And the complex injuries that they call me about are very exciting. And they send me images and stuff like that. So for example, the knee, having an ACL injury is straightforward to me, okay? But then when you have a complex injury where you have an additional posterior lateral corner injury with an MCL injury, with a meniscus tear, and also maybe a cartilage surface damage injury, that becomes a little more complex. And so yes, we take care of, and I take care of a lot of those injuries, whereas if you do one and you don't recognize another, you can have serious implications on their athlete's future where it just won't work for them or they'll have failure. So you've got to be able to recognize all that and be able to treat those as they come to you.
We've done, for example, I did the first meniscal transplant done in this area. We've done ligament reconstructions with allografts and other types of procedures before they were doing them anywhere else. We've probably done more Achilles allograft ACL reconstructions than anybody in the country. And so the advantage of those is the pain is less, the rehab function is way faster, and the ligament structure is stronger. And so those are some of the things that we do commonly that nobody else is doing. We talked about the first integrated sports program, and that was us, and we're still integrated. A lot of the programs use hospitals and use outside trainers. Ours is all encompassing. We use our guys. These are all part of us. And this was how it was drawn up.